Hello, today we're going to be talking about the endocrine system disorders. So I know that many of you have, I know that all of you have taken anatomy and physiology, and you know what an integral part the endocrine system plays in our body and how amazing it is that our bodies work the way they do. Our learning objectives are describing hormones and their functions, explaining how hormones secreted by anterior and posterior pituitary glands affects diseases and their treatments, describing the role of the thyroid gland and its replacement and antagonistic medications, discussing forms of steroids and corticosteroids and their role in treating disorders, describing the role of anti-diabetic agents and adjunctive agents in treating diabetes mellitus. Also, the abbreviation is there, DN capitals. Describing role of glucose and glycogen in maintaining homeostasis, and providing patient education for compliance with medication used to treat diseases and conditions of the endocrine system. So let's look at some endocrine disorders and common symptoms. We're looking at mental deviations, exceptional changes in energy levels, growth abnormalities, skin, hair, and nail changes, weakness and atrophy of muscles, emotional disturbances, psychological disorders, edema, changes in blood pressure with heart irregularities, sexual irregularities, and changes in urinary output. It's really important to use observation in looking at or looking for these common symptoms, because these may or may not be reported to the physician. And when we're taking a medical history, sometimes we might notice something that we want to make sure we get more information on, even if it's not directly reported. So some of the endocrine disorder medications have very common side effects that we're looking for. So these would be increased appetite, swelling, sometimes palpitations, tremors, or extreme nervousness, tachycardia or increased blood pressure. Headache is also a common side effect. Hypoglycemia, nausea, heartburn, diarrhea, and changes in diet. So when patients are reporting and describing, say, palpitations or tachycardia, how do you think they might describe that to you? They might not know to use tachycardia or palpitations, but they're definitely going to talk about some kind of feeling that they're having in their chest or heart. And children will describe this differently because they don't have the schema and the vocabulary to do so. So they might say, that something feels funny in their chest, or they might report feeling scared in their chest, things like that. So it's important to be looking for that. So what are some functions of hormones? They stimulate various tissues and increase activity, and they may also target specific tissues or organs with specific receptors. So the endocrine system is a network of glands that secretes hormones necessary for body functions directly into the bloodstream. And hormones are carried by the circulatory or lymphatic system to tissues and other glands in the body. So here we're looking at figure 20-1 from your book, and it's the major endocrine system glands. And we're looking here, we have pituitary gland here, right there. Over here we have the pineal gland, then the thyroid gland, the thymus right here. Here we have the pancreas, and over here, these two here and here are the adrenal glands. And then looking down here, these are the testes as well as the ovaries here. So what is the function of the hypothalamus, and where is that located? Well, the hypothalamus is important to this system because it regulates the hormone secretions and produces and releases hormones to maintain homeostasis. And yes, if you know that it's located in the brain, you are correct. So now we're looking at figure 22 from the book. And hormones are substances from steroid lipids or can be non-steroidal, so derived from amino acids. And hormones are necessary for regulation of vital processes. Some hormones can regulate the function of other hormones and have physiological effects on metabolism. It's important to have adequate hormones at appropriate receptor sites in order for these organs to function properly. So it really regulates the body. So if hormones are not used up completely, they must be inactivated by enzymes in the blood, in intercellular spaces, livers, kidneys, or target organs, or they are excreted from the body to stay in homeostasis. So hormones produced by the adrenal cortex. There's messenger agents that regulate the inner environment of the body with the nervous system. And steroid hormones regulate vital processes, production of energy, extracellular fluid, adaptation of body to external environments, growth and development, and the reproduction and lactation. An example of a hormone replacement therapy that might be used would be estrogen. So replacement therapy replaces the lost hormones to assist bodies in maintaining homeostasis, and large hormone doses may provide beneficial results in cases of inflammation or arthritis. Can you think of one that can be administered in a large dose for inflammation or arthritis from your reading? So yes, corticosteroids would be one. There are others. Let's look at pituitary gland hormones. So the pituitary gland is the master gland. It regulates the entire endocrine system. How are pituitary gland hormones distinctive? Well, they regulate hormone secretions from other endocrine glands. And the two lobes of the pituitary gland are the anterior and the posterior lobes. Let's look at the anterior pituitary gland. So the role here, we're talking about the growth hormone. It stimulates growth of tissues and organs. So if it stimulates almost all tissues and organs for growth, if we see some other areas, like if it's decreased or increased production, you might see the things listed here as far as deficiencies. Okay, the anterior pituitary gland also has the ACTH, the adrenocorticotropic hormone. So diagnostic testing is primary use. It's rarely used therapeutically. Its basal vital signs are important when using the ACTH. You notify physician of infection when taking ACTH, and patients should not stop taking ACTH abruptly. And these would all be things that you would be doing patient education with your patients if they are going to be using the ACTH for diagnostic testing. So TSH, or thyrotropin, stimulates thyroid gland function. And you would see this used diagnostically to differentiate primary hypothyroidism from secondary hypothyroidism. And it may also be used to test for anterior pituitary gland deficiencies. So the posterior pituitary gland, we see oxytocin, and that's active on reproductive system, functions during labor and delivery, and the antidiuretic hormone, or ADH, and that works on urinary systems by promoting renal conservation of water. So some side effects of ADH are abdominal pain, abdominal distress, nausea, vomiting, headaches, chest pain, and confusion. So thyroid gland is the largest gland. It's located in the anterior of the neck, and there are 2 lobes on their either side of the larynx, and you can see here in this area. There are some thyroid gland hormones. We look at T3 and T4. So T3, triiodothyronine, and T4, thyroxine. We also have calcitonin, and T3 and T4 are controlled by TSH, and T3 and T4 stimulate protein synthesis, increase blood sugar levels, and decrease serum cholesterol levels. So what is the role of iodine in producing the hormones listed? Iodine must be available to produce these hormones. So iodine plays a huge role. Without it, the hormones cannot be produced. And if there is a diet that is deficient in iodine, then this can lead to goiter. Let's look at goiter here. So goiter is an enlargement of the thyroid gland stemming from a diet deficient in iodine. And you can see there, well, I'm trying to point to it, that won't work, but this is an example of goiter. So some more thyroid gland hormones. We use thyroid replacement therapy, so for TSH and T4 levels routinely measured to evaluate the thyroid function. Thyroid hormones treat hypothyroidism, but not obesity. Therapy starts with small doses and incrementally increases until adequate response is reached. And long-term thyroxine is used associated with osteoporosis. So it's important to know the patient's full history when using thyroid replacement therapies. And why do you think patients already on estrogen therapy experience an increase in the amount of thyroid hormone needed? Email me your thoughts on that question for a virtual ticket. I'll ask you that again. Why might patients already on estrogen therapy experience an increase in the amount of thyroid hormone needed? Again, if you email me with your thoughts to that question, I will give you a virtual ticket. So anti-thyroid medications, we're looking at hypothyroidism and hypersection of the thyroid hormones due to tumors or Graves' disease in most cases. The symptoms include increased cell metabolism, weakness, anxiety, and heat production. The treatment may include anti-thyroid medications, irradiation of thyroid gland, and surgical removal of tissue. What are some potential side effects of medication for hypothyroidism? There are rashes, nausea and vomiting, stomach pain, fever. So anti-thyroid medications interfere with the synthesis of the thyroid hormones. So drugs, iodine, radioactive iodine, thiamide, derivatives are given, and the side effects I just listed for you. It's important to note that the agents can cross the placenta and stop fetal development as well. So we need to know if a patient is pregnant. So calcitonin is secreted by thyroid gland, but it works with the parathyroid hormone to ensure adequate supply of calcium. Calcitonin salmon administered in nasal spray as a replacement for human calcitonin. So in the nasal spray, they can take the salmon calcitonin, and this replaces human calcitonin. So indications for the calcitonin salmon, We have chronic diseases of bone characterized by great enlargements and rarefication of bones, bowing of the legs and the leg bones, and deformation of flat bones can all be indications.